this show, we like to think we have your back, and today we really do.
Yeah, in today's Eye on Health, we are talking about spinal surgery that's taking back pain really out of the picture in record time.
And here to talk all about it and the new location where you can find it is Dr. Ryan Sauber, an orthopedic surgeon at Allegheny Health Network. And this is really huge. You were just telling us a little bit about this. This practice has existed for some time, but it's really becoming more mainstream and more readily available.
Absolutely. As there's been a lot of excitement in the spine surgery community about endoscopic spine surgery recently. The equipment has gotten better, the technology has gotten better, and it really allows us to start to journey into a brand new type of spine surgery.
And so this is about relieving compressed nerves in the lower spine. And you brought some instruments here. Mm-hmm. Can you explain to us like what these are and how you would use them?
Absolutely. I'm an orthopedic surgeon by background, so I correlate it with shoulder surgery. Very few people, unless they're having a replacement, get a big incision over their shoulder. We make small incisions and put cameras inside the joint to fix things through small incisions and less damage to the surrounding tissues. So this is the same thing for spine surgery. Instead of opening things up and looking at it with our eyes, we get to make smaller incisions. The cannula that we have is 7 millimeters, so through a 7 millimeter incision, we use this to unpinch nerves, basically get rid of disc herniations.
So who would be a prime candidate for something like this?
So the ideal candidate is patients with disc herniations. Disc herniations are common injuries
and so painful.
And very painful.
Yeah.
A lot of people end up in the ER and they have sciatica and nerve pain going down their legs. So this is ideal for that. We have been fixing disc herniations for a long time, but this allows us to do it again, smaller incisions, quicker recovery time, less pain. We don't use any strong pain pills with the procedure at all, so that's a nice part of it to get rid of.
What are these?
Yeah, exactly. Like this here, it looks like scissors with a big long thing on it.
Absolutely. So again, the cannula, which is what we insert into the spine, and then there's a camera with a 4K camera on the end of it, and there's a small tube through the camera. So the camera goes in through the tube, and then the grasper, which is what this is called, would go through the whole setup, and that would allow us to, with direct visualization of a camera, be able to grab onto the disc herniation and remove it from the patient's back.
And when a disc herniates, for people who may not know, like what is exactly happening within your spine?
So the disc is a cushion in your spine, and if it gets overloaded, it can rupture or tear just like any other tissue in the body. And so a piece of that normal disc will shoot out and sit on top of a nerve. And it's very irritating. The nerve pain's not like other types of pain. It really drives people crazy. So there's plenty of different ways to treat disc herniations. Not everyone needs surgery, but if they fail non-surgical treatment, then taking the disc herniation out is a good option.
And you're making the point of how this is minimally invasive compared to like other surgeries, maybe other techniques. And because of that, the recovery is way different, right? Like, are people leaving that day from the facility?
Yes. The recovery within 30 to 45 minutes, we have people up and walking after the procedure. As long as they can show us they can walk around and do steps, they get to go home the same day. That's all pretty routine for us. The recovery is also about half of what more traditional methods are. So I would typically restrict an athlete or a young person for about 3 months after a normal surgery. This allows us to cut that down to 6 weeks or even less.
It really is incredible, because for people who have herniated discs or any kind of back pain associated with this, it can be debilitating for some people. I mean, it affects your whole body and all of your movement.
Absolutely. And again, the key is minimally invasive. I think that's the future of spine surgery. At Wexford, we have a new program that it's really going to be the hub of our minimally invasive program. We have a multidisciplinary team. There's neurosurgeons and orthopedic spine surgeons. There's pain management doctors, physical medicine and rehabilitation doctors. So everyone's focused on the least invasive nature surgery.
It's wonderful. Really fantastic.
And within AHN, it's happening at AGH, and then you're doing it at Wexford, the Wexford facility.
Well.
All right. So if you want to see Dr. Ryan, go to Wexford.
Thank you so much.
Absolutely. Thanks for having me.
All right. Remember to keep watching for our Eye on Health series right here on PTL. It's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.